Is PEMF therapy safe? There are a lot of different PEMF devices available, ranging in intensity and frequency. Many people think you need high-intensity PEMF therapy, but what does the medical research say about this? Is high-intensity PEMF therapy actually safe to use? If you are looking at a PEMF therapy device, make sure to check us out at healthywavemat.com to see our advanced PEMF therapy mats, which were designed off the independent PEMF therapy research, such as I'm about to show you. Also, another factor to consider in PEMF safety is your device emitting dirty electricity and RF radiation? We covered this in another video. You should certainly watch that as well. But now, let's dive into what the medical research says about PEMF therapy and if high-intensity PEMF therapy is safe to use.
Okay, so this is an article we've had on our website for several years now, which goes over 9 comparative studies about PEMF therapy. What this means is these studies are actually comparing the effectiveness of different intensities, which the vast majority of PEMF studies do not. Well, there are hundreds, if not thousands, of positive PEMF studies out there. There are actually very few ones comparing for us to see which PEMF is the best, to tell us which intensities could be more effective and which frequencies could be more effective as well. This will also give you an idea of the type of research we use to design and base our PEMF technology found in the Healthy Wave mats off, and why we do use a relatively lower intensity and lower frequencies in the Healthy Wave mats. So we're going to go briefly over these different studies now, and I'm going to explain them just in layman's terms. If you do want, we do have the links to all the studies here, and you can read the full studies on PubMed, and some of them even have the links to the full studies on the papers they were published with. But we're going to go into these starting with PEMF Research Study 1. So like a lot of these studies, these were done on cell cultures. None of these were actually, I think, done on people. It's all either cell cultures or animals. So this study was comparing the effectiveness of a PEMF at 6 Gauss 36 Gauss in treating osteoporosis. So this is a very significant thing to look at because there are already PEMF therapy devices that have been approved for treating osteoporosis. So this is going to give us an idea of what level and intensity is most effective when treating osteoporosis. And in this study, it found that PEMFs of 6 Gauss was significantly more effective. And well, both intensities were effective. The 6 Gauss was significantly more. And this is the one thing we're going to go over with all these basically studies, that is this rule that applies. It's called the Arndt-Schultz law. And it basically says when you apply a beneficial dosage of something, you initially will get increasing results. And the more dosage you apply, you'll eventually get a plateau. And then you keep applying dosage, you can get deteriorating results to eventually negative results. And what we know from this, more is not always better. This applies to red light therapy, this applies to PEMF therapy, this can apply to everything. So in these studies, we're going to really see of where that sweet spot zone is for PEMF therapy and intensity. PEMF Research Study 2. So this was done on tendon cells and was comparing a 15 Gauss and 30 Gauss. And this is pretty significant to look at because there are people with tendinitis or tendinopathy, which is a degenerative process causing pain and disability. And again, in this study, it found that the lower result at 15 Gauss was the best, gave the best results basically. Now, PEMF Research Study 3. So this one was actually done on rabbits and was using quite high intensity PEMFs of 100 Gauss and 200 Gauss. You have to remember there are devices out there with higher intensities as well than 100 Gauss and 200 Gauss. Some of them get very, very intense. And this was looking at how these intensities on rabbits would work in relation to wound healing and inflammation in the eye. So they found that the 100 Gauss basically did help a little bit in certain areas, but in other areas it was still identical to the control group. So this is probably in the Arndt-Schultz law of dosage. We're already getting on the deteriorating results, where they actually found that 200 Gauss, there was an increased complication rate. So this is telling us that the 200 Gauss, at least in this study here, was too much for the rabbits. And not only did we get past those deteriorating results, we were going into the negative results as well. So this would kind of be an intensity we would hypothetically want to stay away from or use for a short period of time. Because a lot of these studies, they did use them for fairly long periods of time. PEMF Research Study 4. So this was actually looking at the potentially harmful effects of high intensity PEMF. So this is a perfectly suited study for the video we're talking about here, looking at high intensities basically on the immunological functions of rats at 50, 100, and 200 Gauss. And their conclusion after 10 weeks, the rats exposed to 100 Gauss and 200 Gauss experienced oxidative damage to their livers and spleens. And at 50 Gauss, there was neither positive nor negative results reported. So we can conclude from this that at least over this 10-week exposure, if you want to see exactly how much it was per day, you can read the study yourself. But at 50 Gauss, 100 Gauss, and 200 Gauss, these were all too high intensities for the amount of time that it was exposed for. And 100 Gauss and 200 Gauss were actually causing damage to the rats themselves. So this is something we would not want to experience ourselves, because a high intensity PMF such as 100 Gauss or 200 Gauss over 10 weeks could cause damage to us too, potentially. PMF Research Study 5. So this is a more complicated study, but in layman's terms, the study was looking at the bone formation during fetal development. And this highly relates to bone healing, which a lot of studies have proven PMF is effective for. And in this PMF study, it was comparing the intensities of 10, 20, and 50 Gauss. And again, this study found that the lowest intensity, 10 Gauss, was the more effective compared to the 20 and 50 Gauss. PMF Study 6. Now, this is a really good study because, while this was done on human ovarian cancer cells, we're actually going to debunk several myths and learn a lot about PMF therapy from this. So, basically, this did not compare the intensity levels, but it compared frequency levels. And it also used a sine wave as well. So we're learning about the sine wave, the frequencies, and we also have the intensity of about 10 Gauss, which has been shown to be effective according to the other studies we've seen before. But they tested at frequencies of 8 Hertz, 16 Hertz, 32 Hertz, and 64 Hertz using a sinusoidal wave. And the conclusion was it was the 10 Gauss at 8 Hertz, which was the most effective at not only inhibiting the growth of cancer cells, but killing them off as well. And they were already experiencing a decreasing effect when the frequency was raised to 16 Hertz. So this tells us that even 10 Hertz, while it still can be beneficial, we're getting to that point where we are reaching the upper range of intensities we want to be using, at least in combination with higher frequencies, because it was really only found effective with the lowest frequency of 8 Hertz. And if you'll learn from our other videos on our PMF page, basically the amount of induction that's created, this is how the science behind PMF therapy works. Either intensity is one of the factors that can increase it, or frequency can increase it. So this is telling us that this combination is kind of nearing the peak, and if we did want to use a higher frequency, we would probably want to actually use a lower intensity for optimum results. This also does show us that the sine wave is a very effective wave, and if you look at the research on PubMed, for example, you will find that it actually is the most researched wave out there for PMF therapy. So now let's look at PMF Research Study 7. So this study was examining the effects and the various lengths of time and intensities on the synthesis of bovine cartilage. And this was tested over periods of 1, 2, 9, and 24 hours, and intensities of 5, 10, 15, and 20 Gauss. So in this one, it found that 15 Gauss, a little bit on our higher range of what we've seen from the other ones, it was the most effective, but there were diminishing results at 20 Gauss. So they found this 15 Gauss was probably where in the plateau zone we've talked about. And another interesting thing is there was better results in all of the cases for the longer application. So this is also gives us into this idea and this concept that using lower intensities and lower frequencies over longer periods of time are probably even more effective if there are higher intensities and higher frequencies for shorter periods of time. So just another thing to keep in mind when looking at the right PMF for you. So PMF Research Study 8. So this study was examining at what point certain types of cancer cells, lymphoma U937, basically stopped multiplying using PMFs. So this was using a PMF in the range of 3 to 47 Gauss. So this can be looked at in two different ways. You can look at that, this basically stop this multiplication of these cells, that it's a good thing, or we could be that, well, this is inhibiting cellular division in general. So depending how you want to look at this, it gives us a good look at both ways. But it found that intensities greater than 25 Gauss started inhibiting the division of the cells. So this might be beneficial when we're trying to look at the inhibition, like stopping cancer cells or these lymphoma cells from multiplying, but it also does have that potential bad negative side effect that it actually could stop and healthy cells as well. So something to keep in mind, the actual conclusion from this study is a little bit open up in the air, but I felt it was useful to include. Now, PEMF Research Study 9. So this was actually looking at the bone formation in dental implants in rabbits. So this study examines different intensities of PEMF, and the different intensities are a little bit more in the lower range here of 2, 3, and 6 Gauss. So this also gets a little bit into this bone growth, this osteoporosis, all these different relations to bone, which PEMF is very well known to be effective for. So the conclusion was, after 2 weeks, the greatest bone growth occurred in the PEMFs in the 2 to 3 Gauss range, even compared to the 8 Gauss. So this study was nice because it was actually one of the only studies to include lower intensities such as 2 and 3 Gauss, where most of the other ones were using 6, 10, or even higher intensities as well. So that concludes our 9 PEMF therapy research studies. I hope these research studies provided some insights for you. I feel there is a few conclusions we can draw from these studies. First of all, there is a limited number of different studies comparing intensities of PEMF, frequency PEMF, and waveforms of PEMF. And we've looked through hundreds and hundreds and hundreds of studies, and these are some of the few comparative ones we can find. So when you're trying to determine what is the best PEMF, what is the best intensity, what is the best frequency, well, there's a lot of beneficial intensities and frequencies and durations and combinations basically we can use. There's no conclusive evidence, and that's why at Healthy Wave Mat we try to offer basically a PEMF therapy product that gives you the option to use that safe and beneficial range of intensities and frequencies such as found in our multi-wave PEMF mat. Also, a lot of these studies, one of the conclusions we can find, there was a limited range of intensities basically tested. So for example, when they're testing 10 Gauss and comparing it to 20 Gauss, and they found 10 Gauss is the most effective in that study, this doesn't mean that, for example, 5 Gauss or even 2 Gauss could have even been more effective because that wasn't tested. We do know from the last PEMF therapy study was actually the only PEMF therapy study to test less than 6 Gauss, and it found the intensity levels of 2 and 3 Gauss were more effective basically than 6 Gauss. Also, another thing you need to take into consideration with all of this is basically most of these studies were done on cell cultures. And when you're using PEMF on your entire body, you're affecting a lot of other different components. Why? It's kind of, you want to err on the side of caution and not overdo it. Think of that Arndt-Schultz law. We want to get out into that plateauing zone, and we don't want to get into the deteriorating zone. So when it comes to PEMF therapy, lower intensity PEMFs, they've been proven to be effective. They've been proven to be safe. Same thing with lower intensities as well. So I hope you enjoyed this video. I hope you enjoyed the research. If you want more great information on PEMF therapy, make sure to visit our website, healthywavemat.com, and also subscribe to our YouTube channel as well, because we'll be putting out more content on our website and our YouTube channel.